Insect bites, stings. Poisonous snakes include pit vipers and coral snakes. We have both of those around here. Symptoms usually begin immediately if the bite is envenomated. Pit vipers are characterized by the 1 or 2 puncture marks.
Pit vipers, maybe?
Yeah.
Yes.
What a pit viper is?
Well, it's like rattlesnakes.
Okay.
You get bit. It's all
Randy Rasks is on foot, cutting through an open space on the edge of the city, hoping to reach the bus stop in time so he can get out of the desert heat. As he walks by some sagebrush, he feels a sharp stinging. At the same time, he hears the rattler's warning. Looking down, he sees 2 small puncture wounds just above his left ankle. Oh no, he thinks, and pulls out his cell phone to call 911. When they arrive, what should their initial action be?
Get out of snake bite, kid.
They need
What do you want to try to cut off the circular light?
No. No.
They need to identify the snake, huh?
No.
No?
We need to go ahead and start looking for some antivenom.
Every anti-venom from pit viper is made from every kind of pit viper. So that one anti-venom Profab is made for like rattlesnakes, water moccasins.
Who told me that's dumb?
Isn't it hard to find though? Like, isn't it,
No.
I was watching some ER stores the other night and they do like 14 bags of it. They can find it nowhere.
Well, it is, but it's not. Like our little hospital, we carry 4 vials. They're $1,500 a piece. The normal dose that you would get is 8 vials.
No way.
Y'all don't even have enough for one person then.
It's
Yeah, just-
$1,500 a vial.
So y'all just
Okay,
start the
but it's made
process
Yes.
with the hospital?
Huh?
So somebody, that's what I'm saying, go ahead and start looking for some more, because ain't nobody gonna want just 4 of them. I'm not sure about 4 if I need a snake.
So that means it's gonna be like $2,000 at the
I
hospital.
don't know.
Yes.
You're saying the normal person needs like 8 of them, right?
Yes.
If y'all only have 4, y'all need to go ahead and start looking for 4 more.
My hospital is not gonna keep anything like that. Whether they
What's
have
the point in
8,
having 4 if it's not gonna be enough to fucking
because
treat
you can
someone?
start it.
That's what I said, was look for some more.
Started and transferred.
Just tell me my answer's not
Started
completely
and
wrong.
transferred.
Alright, snake bite. The poisonous snake bite is characterized by 1 or 2 distinct puncture wounds. The exception is the coral snake, which leaves a semicircular pattern with its teeth as it chews on the skin. Yeah, I know. Many people who venture into the outdoors fear the possibility of snake bites, but in fact, such bites are relatively uncommon, and the number of people who die from a snake bite each year is extremely small. And it's usually the people, like the rednecks, where I'm from. Oh, there's a snake. Let me play with it. And that sounds like a great idea. The severity of a pit viper, depending on how much poison was injected, is gauged by how rapidly the symptoms develop. Alright, there's a snake bite to the hand. Emergency medical care for snake bite is the same as general emergency medical care for other bites and stings. Alright, factors that affect the severity, the amount of venom injected, location, presence of pathogens in the actual snake's mouth, patient's weight and size, patient's health, and the amount of physical activity following the bite. Alright, insect bites and stings. Most bites and stings are not serious, but severe allergic reactions can occur. Many people are allergic to the stings of bees, wasps, hornets, and yellow jackets. Localized signs and symptoms include sharp, stinging pain, itching, redness, tenderness, and swelling. Black widow spiders are the leading cause of death from spider bites in the United States. Alright, it has a characteristic black body with a red hourglass marking on the abdomen. When treating a patient with black widow spider bites, you should usually provide general wound care and transport. They will feel an initial pinprick sensation that becomes a dull ache. They can have severe muscle spasms, rigid board-like abdomen, dizziness, nausea, vomiting, respiratory distress in severe cases. Brown recluse spiders bite victims are unaware that they have been bitten because the bite is often painless at first. Several hours after the bite, it becomes bluish around, surrounded by a white around the outside, the peripheral. Then it has a red halo or bullseye pattern appears. Within 7 to 10 days, the bite becomes a large ulcer. And this is what it looks like. 90% of all scorpion stings occur on the hand. Dolls, we have a bunch of freaking rednecks and be like, oh, look, a scorpion, let me pick it up and play with it. And that sounds amazing. Firing at bites can also cause a large local reaction characterized by swelling, pain, and redness that can affect the entire extremity. Lyme disease, usually transmitted by the tiny deer tick, but now thought to be transmitted by other ticks. Alright, ticks can carry tick fever, Rocky Mountain spotted fever, Lyme disease, and other diseases. The only appropriate pre-hospital treatment for a tick bite is prompt removal of the tick, which can help prevent infection. To remove a tick, use tweezers and grasp the tick as close as possible to the point where it is attached to the skin. Pull firmly and steadily until the tick is dislodged. Do not twist or jerk the tick because it can result in an incomplete removal. The head will still be in there, injecting the poison or infecting you. Your priority during scene size up should be to protect yourself and your partner. If your patient has been bitten or stung, you too might fall victim to bite stings unless you exercise caution. Let me just tell you, that ain't gonna happen to Caleb. Anaphylactic shock generally has a rapid and life-threatening effect on airway and breathing. We've already been over this, right? Look for signs and symptoms of anaphylactic shock and intervene immediately. Anaphylaxis, life-threatening, develop following bites or stings. Develop signs and symptoms of this condition, perform the necessary emergency care and transport. Additional signs can include confusion, loss of responsiveness, convulsions, and hypotension. If they are hypoxic or their SpO2 is less than 94, you want to administer oxygen to maintain 94% or greater. Administer epi with a prescribed auto-injector with permission for medical direction for patients with airway obstruction, wheezing, hypotension, or prior anaphylaxis, and go ahead and request ALS. There's more medicine that we can give them. Alright, signs and symptoms of a snake bite or sting. Or a bite or sting. History of a bite or sting. Alright, from a spider, snake, or sting from an insect, scorpion, or marine animal. Pain is often immediate and severe or burning. Within several hours, the area can become numb. Is that okay? Somebody pass out? You can have fever, chills, dizziness, bite marks, can still be a stinger in place. Alright, if they are stung by something, scrape the stinger in the direction of the base of the stinger to avoid breaking it off below the skin. Be careful not to squeeze the stinger with tweezers, forceps, or your finger, as doing so can force additional venom from the venom sac into the wound. Make sure you remove the venom sac because it can continue to secrete venom even though the stinger is detached from the actual insect. Some experts advise the use of constricting band in the treatment of a snake bite proximal to the bite, but however, we do not do this anymore. You want to take a pen or marker and mark where the redness is and put a time there, alright? Every 10-15 minutes or so, you need to see if the redness is swelling, is spreading. And then you need to mark that and put a time on there. Anaphylactic shock can take minutes to several hours to develop. You should be alert to its appearance and be prepared to provide emergency medical care for this life-threatening condition. The venom of marine life can cause more extensive tissue damage than that of land animals. Venom of aquatic organisms are destroyed by heat. So heat should be applied to marine bites and stings. In general, bites and stings inflicted by marine life should be treated the same as soft tissue injuries. If the patient were stung by a jellyfish, coral, hydra, or anemone, carefully remove dried tentacles and pour vinegar on the affected area to denature the toxin. I'm not real sure where you're supposed to get vinegar from, or meat tenderizer. If meat tenderizer is available, sprinkle the area with it. Doing so helps stop the stinging. Note to self, go to Walmart, get the vinegar and meat in the rest. Alright, lightning strike injuries. 100 million to 2 billion volts per volt. Alright. Travels 1 to 2 million meters per second, and the contact temp is 15,000 to 60,000 degrees Fahrenheit. Rapid expansion of air around the lightning bolt propels the person, causing blunt trauma. Changes in air pressure can damage the body's air-containing organs. A direct strike carries the highest rate of injury and death. In a ground current, the farthest the patient is from the strike, the less injury and the other effects suffered by the patient. The heart muscle has properties of automaticity, which means that it can stimulate its own impulse without the help of the brain. What commonly happens in a lightning strike patient is that the heart begins to beat spontaneously on its own without any intervention. However, the inspiratory centers in the medulla of the brain remain dormant for a much longer time. Despite the patient's heart resuming its beat and regaining a spontaneous pulse, the patient cannot yet begin to breathe on their own. This is not good. Alright, some of the things you're going to see with their nervous system: altered mental status, retrograde, anterograde amnesia, weakness, pain, tingling, numbness, pale, cool, clammy skin, possible modeling or cyanosis, temporary paralysis, loss of pupillary function, and seizures. Abnormal nervous system findings can be due to head trauma from blunt trauma and not the lightning strike itself. Alright, they can go into cardiac dysrhythmia, such as asystole, and ventricular fibrillation. They can have irregular pulses, respiratory distress, and even apneic. Burns, most often superficial, partial thickness and full thickness burns, are typically caused by metal heating up on the patient. Linear burns appear as streaks down the body by sweat heating up on the skin. Feathering is not a true burn. It appears as a non-blanching reddish pattern or a fern pattern. Punctuate burns appear similar to cigarette burns. Thermal burns can occur if the clothing catches fire, and they have various unusual patterns. You can also have dislocations and fractures from these lightning strikes as well. Contrary to a common misconception, lightning injuries are not typical major burn injuries. However, superficial linear patterns called Lichtenberg lines are common. I guess Lichtenberg was struck by lightning and had these lines, and they named it after him. Alright, you can have unequal pupils, drooping eyelids, ruptured eardrums, tinnitus, deafness. I think I'd rather be deaf. Alright, we want to ensure that the scene is safe. If the clothing is on fire, stop, drop, and roll, put it out. Establish an line stabilization. Open the airway. They cannot. If the patient is in cardiac arrest, immediately begin CPR and attach the AED. Deliver defibrillation based on the analysis and prompts of the AED. Provide aggressive ventilation with high concentration of oxygen. Transport while continuously monitoring the patient's condition. High altitude sickness. Some of your general symptoms is ill feeling, loss of appetite, headache, sleep, disturbances in sleep, respiratory distress upon exertion. High altitude is greater than 5,000 feet, but serious illness usually occurs at altitudes greater than 8,000, especially with rapid ascent. High altitude sickness can be prevented by ascending gradually, allowing the body time to acclimate, limiting exertion at high altitudes, descending to a lower altitude to sleep, and eating a high carb diet. Alright, we've already been over signs and symptoms. Acute mountain sickness occurs when there is a rapid ascent to 6,600 feet or higher. Symptoms develop between 6 and 24 hours and can worsen if the person goes higher. They will have weakness, headache, lightheadedness, fatigue, difficulty sleeping, loss of appetite, nausea, shortness of breath. Often resolves itself within 1 to 2 days if the patient does not go any higher. Alright, an SpO2 of 90% is often considered a normal SpO2 reading, or the number to achieve during oxygenation to relieve hypoxia. And this is acute mountain sickness. But you need to follow your local protocols. Changes in the pressure of the pulmonary vessel causes fluid to be forced out of the capillaries and to collect in and around the alveoli. Children and men are more prone to high altitude sickness. Or high altitude pulmonary edema. Alright, crackles and wheezing occurs in at least one lobe of the lungs. You can have a headache, loss of appetite. High altitude pulmonary edema can take 36 to 72 hours to resolve with oxygen therapy alone. The best treatment? Get yourself down. Alright, most cases occur greater than 12,000 feet. Why you don't want to go up that? I don't know. Fluid in the brain tissue increases the pressure within the skull and puts pressure on the brain. This is high altitude cerebral edema. You can have a severe headache, coma, seizures, altered mental status. In severe cases, it can be necessary to provide positive pressure ventilation with oxygen connected to a ventilation device. What do you do to treat this? Come on down the mountain.
So if their SpO2 is normal at 90, you would still give them oxygen because we have to give it at 94?
If it's this, it's probably going to be a normal reading of 94. I mean, you can give them oxygen, they won't really ain't gonna hurt them, but would I put them on 15 liters? No.
So it's just like a 2 measures on
Yeah.
those?
Alright, EMTs arrive, thankful for boots that reach above the ankle. They look and listen carefully as they approach Randy, ask him if he saw where the snake went. Rather than begin secondary assessment and treatment in the open space, they feel it's safer to put Randy in the ambulance. Randy is positioned with his legs flat on the stretcher for the ride to the hospital. They care for Randy by obtaining a history and complete set of vitals, place the dressing over the puncture wound, which continues to ooze blood. He then notifies the receiving hospital, giving a description of the snake as Randy had described to him. They used to tell you to kill said snake and take it to the hospital with you. Let me just tell you, that's not fixing to happen. The snake's not getting in my truck. The spider's not getting in my truck. The scorpion's not getting in my truck.
At
It's not happening.
At the hospital, my mom used to work for infection control, and if you get bit by a bat, they tell you literally to kill it, and they put it in the morgue and they test it for whatever disease bats carry. But you literally have to bring your bat.
It's
with you.
rabies.
Yeah, rabies.
Yeah.
You literally have to kill the bat and take it to the hospital, and they put it in the morgue.
Same thing with like raccoons and cats.
Yeah. That's not getting in my truck. Alright. Medical direction advises against a constricting band. By the time they reach the hospital, Randy's left foot and ankle have begun to discolor or swollen. Fortunately, antivenom is immediately available. Alright, anybody got any questions about that?